Okay, we are continuing our conversation on financial issues, chapter 14, and we are looking at managed care programs. Okay, um, before we get there, let me go into a little bit more uh, details in relationship to private health insurance. Basic private health insurance policy may pay for prescribed expenses such as prescription when the patient is covered by a supplementary comprehensive major medical policy, or when the patient's coverage includes an additional prescription drug benefit. Patients covered by comprehensive major medical policies pay out of pocket for their prescription. Once a deductible is met, the insurer may pay a portion of the cost of the prescription filled the rest of the year. Okay. Um, so this falls under what is called prescription drug coverage. So some traditional health insurance policies have added have an added benefit of prescription drug coverage. That is, patients with prescription drug coverage through the patient's private insurance company are issued a prescription drug benefit card to carry in their wallets. These cards contain necessary billing information for pharmacies, including the patient's identification number, group number, and copay amount. As with other prescription plans, there may be various types of copays, and payments may be required to get generic drugs when available. Many third-payer programs for prescription drugs have drug formularies. A drug formulary is a list of medications that are covered by third-payer party program. Patients are given their formulary's information when they register for benefits. Additionally, some third-party programs have different what's called tiers or categories of drugs with corresponding differences in copays depending on which tier a specific drug is in. All right, let's go ahead and take a look of managed care program. Managed care programs include health maintenance organizations, those are HMOs, point of service programs, POS, and preferred provider organizations, or PPOs. Right, so let's go ahead and take a look at this. And the reason why these were developed, some started out in the 1960s, 70s, 80s, came really big in 1980s and 90s as they were skyrocketing prescription drug prices and healthcare costs, trying to find a way of delivering affordable care at a lower cost. So HMO are made of a network of providers who are either employed by the HMO or have signed contracts to abide by the policy of the HMO. POS, or point of service, programs are made of a network of providers contracted by the insurer. And then PPOs are also a network of providers contracted by the insurers. Of the managed care programs, PPOs offer the most flexibility for its members, right? And so those are the different type of managed care programs that you should be familiar with. All right, so let's take a look now at other third-party programs. You have what is called Medicare Part A, Part B, Part D, which consists of medication therapy management, or MTM, and prescription drugs. So we talked about this a while back when we were talking about the different type of laws. Medicaid and Medicare came about in the 1960s, associated with President Johnson War on Poverty. And so let me give you what Medicare is. So Medicare is a federal program covering people ages 65 and over, as well as disabled people under the age of 65. in people with kidney failure. So Medicare Part A basically covers inpatient hospital expenses for patients who meet certain conditions, and it may also cover some hospice expenses. Medicare Part B basically covers doctor services as well as some other medical services that are not covered by Part A. Medicare beneficiaries who pay a monthly premium for this medical coverage is covered by Medicaid Part B. And then Medicare beneficiaries may enroll in Medicare prescription drug plan, also known as Medicare Part D. Okay? And you have an aspect of that that is also very important. Some Medicare beneficiaries may not have any prescription drug coverage if they do not participate in either the Medicare drug plan or prescription drug plan from a current or previous employer. And then some individuals may be actually covered by what's called medication therapy management or MTS services that's provided by pharmacists. Let's look at Medicaid. Medicaid is the federal state program for eligible individuals and families with low incomes. State welfare departments usually operate Medicaid, and each state decides who is eligible for Medicaid benefits and what services will be ordered. All right. So that is the rundown on Medicare and Medicaid. Very important. Let's look at other third program programs. We have workers' compensation. In the United States, the federal government and every state have enacted what's called workers' compensation laws. This is very important. I must say, personally, I had an injury that was covered by workers' comp. So I understand the importance of this particular law. So under workers' compensation legislation, procedures for compensation for employees accidentally injured on the job are established. Administrative guidelines require that accidents be reported to a public board that grants compensation awards to injured workers. Right? Something else that falls under other programs, third-party programs, is what is called patient assistance programs. Patient assistance programs are programs offered by some pharmaceutical manufacturer to help needy patients who require medication they cannot afford and do not have insurance coverage. Many of the larger pharmaceutical companies do offer this type of program for individuals. Then you have what's called the coordination of benefits. Many households with two adults who are spouses or domestic partners have two different health insurance plans. A growing number of employers are requiring both adults to subscribe to a health insurance plan that are available, which could result in the adult as well as any dependent children having coverage on two different plans. When this happens, there's a need for coordination of benefits. So the coordination of benefits allows for the patients to have maximum coverage for healthcare expenses through both health insurance. The rules for coordination of benefits ensure that the benefits coverage for the claim does not exceed 100% of the total cost. An example of coordination of benefits in the pharmacy is if one pharmacy benefit plan is billed for a prescription and a secondary pharmacy benefit plan is billed for a copay or co-insurance. All right, so something that's very important is what is called online adjudication. Right? In online adjudication, the technician uses the computer to determine the appropriate third-party exact coverage for each prescription. The pharmacy computer communicates with the insurers or pharmacy benefit managers' computers to determine this. Most community pharmacy computer programs are designed so that the prescription label does not print until all confirmation of the payment is received from the insurer or the PBM. All right, so what is an online process? One, while the non-patient information is taken, is provided by the computer system. In many cases, the pharmacy clinician is responsible to obtain certain information, such as coming from the patient prescription, also the billing information. And a patient presents a prescription and offers a prescription drug card to the clinician, who must then obtain all the patient's and billing information required and enters a claim associated with the prescription. If the patient has a prescription filled previously at the pharmacy, much of this information will be in the system already. Okay, but it's very important that the technician verify if the information is still correct every time that patient comes. So once the information is obtained, it is entered by the pharmacy clinician to the pharmacy computer. The billing information is then provided for the prescription, and that's transmitted to a processing computer, which is associated with the PBM or with the insurer. The pharmacy technician usually has the opportunity to review the data provided by the claim processing computer before he gives an okay for the prescription label and receipt to print in the pharmacy. When pharmacies are then billed online, the pharmacy has to keep a record to verify that the prescription was actually dispensed. Insurers and PBMs require pharmacies to maintain hard copies of each prescription that must be readily reviewed upon request. All right, so what are some of the information needed for the online adjudication process? Well, just to go through it in general, of course, the cardholder identification number. This is usually associated with the insurance company. Group number. You have to have name, birth date, gender, relationship to the cardholder. And this is an example, like for example, a parent may be picking up a medication for for their child, or a child or an adult child may be picking up medication for their elderly parents or sick parents. The date the prescription was written, the date that prescription was dispensed. Is this a new prescription or refill prescription? The drug code number, the NDC of the drug, the DAW indicator of the drug, which means no dispense as written. Okay, so can it generic be substituted? Of course, the amount or quantity of the drug, the amount supplied, for how many days, the prescribing identification, the pharmacy identification or NPI, okay, and that is the National Provider Identifier, and CVS, Walgreens, Rite Aid, any of those pharmacies has NPI, a code, a number that identifies them with the government, the ingredient cost, the dispensing fee, the total price, the deductible copay, and finally the balance that is due. All very, very important. Okay, so I'm going to stop here, and we will continue and talk about online process. DAW. DSW means no dispense. No dispense as written, and we will go over that